students, today we are going to talk about the diagnosis of diabetes mellitus. In this topic today, we'll discuss the normal glucose levels to the impaired glucose level and how the diabetes is developed in a patient based on the clinical values. So the normal glucose level is maintained in a normal patient or a non-diabetic patients in the range of 70 to 120 mg per dl. So the term glycemia indicates the glucose levels in the blood. A patient can be euglycemic, a patient can be pre-diabetic or diabetic. So in a euglycemic patient, we see the values are in the normal range, which I just mentioned above, that is 70 to 120 mg per dl. In a pre-diabetic patient, the values are disranged, and in a frank diabetic patient the values are in the WHO criteria ranges. So now you will be a little bit puzzled about the terms pre-diabetic and diabetic, since I am saying that both the conditions have impaired blood glucose levels. So as to clear that doubt, my students, I am going to educate you about the pre-diabetic conditions in the on basis of three terms. The first term I would like to introduce is the IFG, impaired fasting glucose. The second is the IGT, or the impaired glucose tolerance, and the third is the OGTT, 2-hour oral glucose tolerance test. Now, studying briefly about each one of these terms, I hope you will understand them, because this is the simplest language or the simplest way that I could explain you all these terms without making any confusions to you. So IFG, or the impaired fasting glucose, now as the term says, it says the impaired fasting glucose. So impaired fasting glucose means that a patient has not eaten any meal, and at that time what are the levels of the blood glucose are not in the normal range as of a non-diabetic patient, but they are deranged, that is impaired fasting glucose. So what is the level at which we say it is a patient is an IFG? It is 100 to 126 mg per dl. This diagnostic criteria does not need glucose tolerance test. Now, if a patient is showing this range in a fasting state, that means the patient has been moved from a normal glycemic state to a pre-diabetic state. So, a glucose tolerance test, or the OGTT, is not needed. Individuals have an increased risk of frank diabetes and cardiovascular disease. Now, I'm going to talk about the term IGT, the impaired glucose tolerance, which has a range of a blood glucose level between 140 to 200 mg per dl. But it is not a disease, a risk factor for future diabetes and the cardiovascular disease, or the CVD. HbA1c in the range 5.7 to 6.4% includes the pre-diabetes. Risk in pre-diabetes, there is a progression to the frank diabetes, and there is a progression to the cardiovascular disease. Now, my dear students, I would like to draw your kind attention towards the very important thing, which is the risk of the cardiovascular disease in a diabetic patient. So we will be discussing about such kind of cardiovascular complications related in the diabetes in the next video, in the upcoming videos. Now I'm going to discuss with you about the WHO criteria for the diagnosis of the diabetes mellitus. What does the WHO say? How to categorize a patient based on some laboratory values in the category of the diabetes mellitus. So WHO says the fasting plasma blood glucose, if it is more than 126. These values, my dear students, must be remembered thoroughly by each one of you, so as not to commit any gross mistake even in your exams or in your practical life. So fasting plasma glucose level, if more than 126, we say it is a patient of the diabetes mellitus. A random plasma glucose, now the random plasma glucose, the RBS, which is commonly checked in all kind of patients and every wards in the hospitals. Now if it has a value of more than 200, then it is a best condition to categorize the patient as the diabetic. One, abnormal laboratory values, diagnostic and symptomatic individuals. Now, what is a symptomatic individual? We studied about the symptoms of the diabetes in the previous videos. The characteristic features of the feature of a diabetic patient is polyphagia, polydipsia, and polyuria. So, any one abnormal laboratory value with the symptom. This categorizes the patient as a diabetic. two values are needed in asymptomatic. If the patient is asymptomatic, then the two values will be the FBS, the fasting blood sugar levels, and the RBS, the random plasma sugar levels. The glucose tolerance test is only required for the borderline cases. Now, what are the borderline cases, my dear students? The one which were categorized as the pre-diabetic patients. Okay, and for the diagnosis of the gestational diabetes, now you will read about it in your obs and gynae that there is various tests and various guidelines being followed all over the world for the diagnosis of gestational diabetes, that is the diabetes in the pregnancy, and how it is diagnosed and how it affects and how it is managed in a pregnant woman. So in India, the DIPSI guidelines are followed, for which you will be more educated about in the obstetrics and gynecology. Now the HbA1c values is more than 6.5. Now the next is criteria for the diagnosis of the diabetes. This was the criteria by the WHO, my dear students. This is by the American Diabetes Association. Now it is basically purely for the purpose of the exams or the competitive exams. They must they must ask you about the questions based on the American Diabetes Association and criteria and the WHO criteria, but talking clinically, the WHO criteria is only followed. So according to the American Diabetes Association, typical symptoms of the diabetes mellitus, that is polyuria, polydipsia, weight loss, plus random plasma levels more than 200, symptoms of the diabetes, plus RBS or more than 175 mg per dl. Or now this is the first criteria. The second criteria says the fasting plasma glucose of more than 126 mg per dl, or the 2R OGT, the oral glucose tolerance test, and the 2R plasma glucose are more than 200, and the whole blood is more than 175 mg per dl, and during an oral 75 glucose tolerance test, all the glycated hemoglobins are more than 6.5. So in the summarized way, or in the end, whatever the American Diabetic Association is saying, it is combining two or more factors which are laid out by the WHO. So for the pure clinical purpose, or for a good understanding about the association of the plasma glucose levels and between the diabetes, we will follow the WHO criteria and we will remember all these values very thoroughly. Now, students, we are going to talk about the glycosuria as a condition in which there is abnormal excretion of the glucose in the urine. Talking about the same, first we need to know about the normal renal threshold of the blood glucose, which is 180 mg per dl, above which there is excretion of the glucose in the urine in the abnormal values, and it is called as glycosuria. Now let's briefly talk about what is the renal threshold. I hope you guys must have thoroughly studied or understood about what is the basic term, which is the renal threshold, but let's revise it again. So the renal threshold is meant by that value of the blood glucose above which or at which there is no excretion or a minimal excretion in the normal limit or the normal range of the blood glucose in the urine. But as the value of the blood glucose exceeds the 180 mg per dl, there is abnormal excretion of the glucose in the urine, which is also known as the glycosuria. Now talking about if the blood glucose exceeds the renal threshold, as I just said, and it is more than 180, or it is about 180 to 200, then it is excess glucose is not reabsorbed by the renal system. It is eliminated in the urine. It is known as the glycosuria. Now this is a very important thing which is not usually understood by the students. There are two types of glycosuria. One is the renal glycosuria and the second is the elementary glycosuria. Now how both of these are different? Talking about the renal glycosuria, there is excretion of the glucose in urine even at normal blood sugar levels. Now this is a twisting story here, my dear students. The pathology lies in the renal system, not in the endocrine system or the plasma glucose levels. Now, even in the absence of any signs of the generalized PCT dysfunction. Now, PCT is the proximal convoluted tubules, which is a part of the functioning unit, nephron of the kidney. Now, the renal glycosuria is totally based, as the term says, the renal glycosuria. Now, here the culprit is the renal system and not the blood glucose levels. Secondly, talking about the elementary glycosuria, there is a transient abnormal rise in the blood glucose levels, after which a moderate amount of meal that can cause glucose excretion in the urine. Now here in the elementary glycosuria, there is excess intake of the food, there is excess intake of the carbs and the sugar, due to which there is spike in the blood glucose levels that is causing the abnormal excretion of the glucose in the urine, known as the glycosuria. Here the renal system is not a culprit. The pathology purely lies in the alimentary system. Now it develops as the blood sugar level exceeds normal renal threshold, which is the 180 mg per dl. Now in the diabetic patients, you must answer me now, what kind of glycosuria is found? It is the elementary glycosuria. Okay, in the renal glycosuria, there is decreased renal threshold, but in the elementary glycosuria, the renal threshold is maintained by the renal system, that is 180 mg per dl, but there is pathology or there is rise in the plasma glucose levels above the renal threshold. Now and in the renal glycosuria, the renal threshold is decreased, so that it's so due to which even the normal plasma glucose levels are fallen in the excess category, and hence there is excretion of the glucose in the urines. Now the diagnosis of the renal glycosuria is made based on the M.B.B.S criteria. Now what is the M.B.B.S criteria? We'll be discussing it. Talking about in the elementary glycosuria, the conditions associated is following gastric surgery, hyperthyroidism, any liver disease. The oral glucose tolerance test reveals peak at 1 hour OGTT, and the M.B.B.S and the postprandial blood sugars normal at 2 hours. Now, what is the differential diagnosis of the glycosuria, my dear students? Glycosuria with the hyperglycemia. Endocrine disorder will be the diabetes mellitus. Now, if we are having a patient, if we are dealing with a patient which is hyperglycemic as well as with the complaint of the glycosuria, what differential diagnosis we can think of? It is diabetes mellitus or acromegaly, Cushing's syndrome, hyperthyroidism, hyperadrenocortism, functioning of alpha or beta pancreatic cells, tumors, pheochromocytoma. The non-endocrine diseases which could be possibly thought of, there is increased intracranial tension by a brain tumor or due to any hemorrhages, liver disorders, drugs like corticosteroids, adrenocorticotropic hormones, thiazides, and elementary glycosuria. So glycosuria without hyperglycemia will be the renal glycosuria and the pregnancy. Now pregnancy, it is a hyperdynamic state of a human body, and there is excretion of the glucose in the urine, and that is considered as a physiological thing, but there is no hyperglycemia seen in the patients. Talking about the M.B.B.S criteria, my dear students, it is to diagnose the renal glycosuria, in which the pathology is all the culprit lies in the renal system. There is constant glycosuria with little fluctuation related to the diet. Now the diet will directly affect the plasma glucose levels, and there is very little association or the changes seen in the glycosuria with the changes of the diet. That is the first criteria. So second is the normal OGTT. Now we are saying that the patient is not hyperglycemic as discussed above, but there is glycosuria. So that is the indication for the categorization of the patient as the renal glycosuria. Identification of the urinary reducing substance as the glucose. Normal storage and utilization of the carbohydrates. Now we are talking about the oral glucose tolerance test. As we have discussed it, as we have said about it at multiple times and in various topics. Now what is the OGTT? The OGTT is the oral glucose tolerance test. As the term describes, the patient is being given orally a dose of glucose, and how the body of the patient is being responding or is responding to that oral glucose, that is observed, and based on that observation the patient is then categorized in the diabetic, pre-diabetic or normoglycemic category. Now, what are the indications if there is patients with the fasting blood sugar levels of 100 to 120 mg per dl? Now let's revise about the criteria that the WHO set to categorize as a patient as a frank diabetic. It was fasting blood sugar levels more than 126. Now, if the fasting blood sugar level is more than 100 but less than 125, then we are going to prescribe the OGTT test. Second is the diagnosis of the gestational diabetes mellitus by using the DIPSI criteria in the India. Now, the preparation of the patient, how the patient is prepared for this test. Carbohydrate restricted diet for more than 3 days. There is no intake of the carbs by the patient 3 days or for more than 3 days before the test. There is an overnight fasting, that minimum of the 8 hours. Rest for 30 minutes. Avoid tea and coffee before the test. Now, talking about the test, how it is performed. 75 milligram of the glucose is dissolved in 250 to 300 ml of the water and given orally over the 5 minutes. Now, over 5 minutes the patient is asked to drink that solution in which there is 75 grams of the 75 mgs micrograms of the glucose and 250 to 300 ml of water. For children, and that was the adult dosage. For the children, the dosage is 1.7 grams of glucose per kg body weight. So as not to have some false test or the false results or the false positive thing in the children, the dosage is changed. Kindly remember this. It can be asked in the competitive exam, or it is also important by the clinical perspective. Then the time of starting dose taken as the 0 hour. A single venous sample drawn 2 hours after the glucose administration. If there is the values are between 140 to 200, then it is termed as the impaired glucose tolerance, and hence the patient is then taken up as a diabetic one or the pre-diabetic one, and then followed up based on the values of the oral glucose tolerance test. Thank you, my dear students. For today, the video is limited to these topics. I hope you are able to understand about what is being taught in the topics. I hope I am able to deliver all the information related to this topic in an easy manner, so as for you to remember it and apply it more in your clinical life. The next video will be comprising of the following topics in the diabetes mellitus. For the future notifications, please subscribe, share and like and comment the video. And for any kind of your questions or your doubts, please drop your questions in the comment section. I hope I was able to help you guys. Bye. Take care.